Okay, so now welcome back to the second part of the video, that is menopause and HRT. In this video, we will study about the management of the menopause. Okay, so what is HRT? That is hormone replacement therapy. What are hormones that are supplemented or that are given in postmenopausal women so as to decrease the postmenopausal symptoms like night sweats and hot flushes. Okay, these are the ovarian hormone supplement that are given post menopause. So what is the management of menopause? HRT. Okay, so it can be lifestyle modifications that will not affect much, but it also has some impact, as well as the non-hormonal changes and the hormonal part, that is the HRT. So what does HRT does? It replenishes the ovarian hormones and ovarian hormones that is diminished during the natural menopausal transition. And you have to treat the night sweats and hot flushes. Okay, so what is the traditional HRT? Traditionally, before we were giving traditional HRT consists of estrogen and progesterone combination. Okay, so this is low dose estrogen and progesterone combination that is approved by FDA. FDA approved. FDA, and that treats the vasomotor symptoms as well as that prevents osteoporosis. Okay, prevents vasomotor symptoms and prevents osteoporosis. Okay, so what are the available estrogen therapies? So what are the preparations? The estrogen preparations that are available are first one is ethinyl estradiol. Ethinyl estradiol, conjugated equine estrogen, synthetic conjugated estrogen, and micronized 17 beta estradiol. Okay, so these are the preparations that are available. So what is the route by which HRT or estrogen can be given? It can be that is the estrogen and low dose estrogen and progesterone preparations that can be given orally, vaginally, transdermally. Okay, so then coming to the indications. See, the only one indication, the absolute indication for HRT is postmenopausal hot flushes. Okay, moderate to severe postmenopausal hot flushes are the only indication but it can also be given in the local. Okay, the local estrogen can also be, that is available as estrogen creams or gels. So that can be given for genitourinary syndrome of menopause. As in the previous video, I have mentioned about the symptoms and signs of genitourinary syndrome of menopause. Okay, what happens there? Vaginal dryness, dyspareunia, okay, itching and formation of the spots, hemorrhage, okay, dryness of the vagina. So that is treated by local estrogen, okay, local estrogen cream. And also for the prevention of osteoporosis, we can give the HRT. So what is the indication? First, see, various guidelines have various guidelines that influence the use and risk of the HRT. That includes what? Who will give the guidelines? That is Menopause Society, PCOG, NICE guideline, and US Preventive Services Task Force. Okay, so that influence the use as well as risk of HRT. So these are the guidelines. So after 2022, okay, after 2002, okay, use of menopausal HRT declined. Why? See, after 2002, use of menopausal HRT declined. Why? Because a WHI, that is World Health Initiative trial, in WHI trial, they did a trial where they falsely have given the report that there is substantial increased risk for health concern. Okay, there are safety concerns, okay, from conjugated equine estrogen and medroxyprogesterone acetate. So that means there are safety concerns, means health concerns are there with the use of HRT. In 2002, WHI trial, that is the World Health Initiative, they said that there are safety concerns for the use of conjugated equine estrogen as well as the medroxyprogesterone acetate. So for that, the use rate that declined from 8.6% to 2.8%. So there was significant reduced in number because they falsely generalized the above reports. They did the study on the what? In the patients that they have no risk. Okay, no risk patients were undergone the trial, and so the WHI trial, they falsely claimed that the safety concerns are there in the use of conjugated equine estrogen and the medroxyprogesterone acetate. So the use rate was declined from 8.6% to 2.8%. But then after that WHI trial, again they revised. Okay, they did a new study. Okay, WHI, they did a new study in which they said that they found out that conjugated equine estrogen, reduced the breast carcinoma risk by 23%, as well as the cardiovascular risk also decreased. and osteoporosis risk increased if HRT was used after final menopause period. Okay, if after FMP the HRT is used, then there is increased chances of osteoporosis, as well as if before it is used, then osteoporosis risk is increased if it was used before final menopause period. Okay, if before it was used, then there is increased risk of osteoporosis, as well as if the HRT is used after final menopause period, then it is safe. Okay, so what is the indication? The three indications, write it down here. First is the moderate to severe indication is first, it is moderate to severe hot flushes or vasomotor symptoms and genitourinary syndrome of menopause. Here local estrogen is used. And third is prevention of osteoporosis after FNP. After final menstrual period. Okay, after FNP, if it is used, then it decreases the chances of bone fracture. Okay, so what are the regimens that are used? Regimens that are used if a woman with uterus, that means if no hysterectomy is done postmenopausal, if uterus is present and hysterectomy is not done, then we use estrogen plus progesterone to decrease the chances of endometrial carcinoma. And if the woman is present, okay, without uterus, then only estrogen can be used. Okay, estrogen only. So what is the contraindication? The contraindications for the HRT are if there is family risk of breast carcinoma, risk, and history of breast carcinoma, and if there is unexplained vaginal bleeding. And if we give again estrogen, there will be estrogen and progesterone with unexplained vaginal bleeding. So it will mask the actual cause of bleeding, and we may not know any other underlying pathologies. Okay, unexplained vaginal bleeding, any bleeding disorders or any clotting disorders like factor V deficiency, factor V Leiden mutation, factor V Leiden mutation, as well as if the patient had previous history of thromboembolism, DVT, pulmonary embolism. Okay, so here the HRT is contraindicated. Okay, another one, if uncontrolled blood pressure, uncontrolled BP, or there is increased uncontrolled triglycerides. Okay, if more than 400 milligram per deciliter, then also HRT is contraindicated. So menopause, we have learned about what? Indications and contraindications. So now, see, these are the contraindications. So Menopause Society has given the black box warning. Okay, in these cases, the HRT is contraindicated. So Menopause Society, Indian Menopause Society has given black box warning. Okay, that applies only to conventional HRT. Okay, conventional HRT, and is not applied to the transvaginal estrogen, and it is not applicable to transvaginal estrogen. Transvaginal estrogen means the preparation of the estrogen that we give transvaginally in the form of gel, cream, rings or pessaries. Okay, so this is not applicable. The Menopause Society had said that this the black box warning or the contraindications that we have listed above, that applies only to the what? Conventional HRT and not to the transvaginal estrogen, okay, or local estrogen. So what is genitourinary syndrome of menopause? So where are the transvaginal estrogen used? Here it is used in the transvaginal or vulvovaginal therapy, or in the genitourinary syndrome of menopause. Genitourinary syndrome of menopause. Okay. So estrogen, it is FDA approved for GSM as well as the dyspareunia. Okay. So estrogen is FDA approved for genitourinary syndrome of menopause as well as dyspareunia. Dyspareunia also occurs in GSM along with urinary symptoms and vaginal symptoms. And what about the effectiveness? Local estrogen is more effective than systemic estrogen preparation. Okay, so local it is more effective. So what are the preparations that are available? Estrogen cream in the form of conjugated equine estrogen and estradiol, ethinyl estradiol, and vaginal estrogen tablets. Vaginal estrogen estradiol tablets and soft gel estradiol tablets, inserts and 2 milligram estrogen rings. Okay, so these are the forms. Local, it is more effective, and the forms that are available, it is cream, gels, inserts and tablets as well as rings. Okay, so all FDA approved oral conjugated equine estrogen, that is 0.3 milligram per day, as well as the and transdermal is not as effective as that is the transdermal estradiol, that is 12.5 microgram per day, is not as effective as local. as the above local preparation. These are the local preparation. Okay, estrogen cream, vaginal estrogen tablet, soft gel and soft gel inserts and rings. Okay, these are more effective than the oral preparations like conjugated equine estrogen and transdermal estrogen. Okay, that comes in concentration of 0.3 milligram per day and 12.5 microgram per day respectively. Okay, so then coming to the this is the vulvovaginal therapy. It is gone there. Okay. Then coming to what? Dosages of estrogen. See, what are the estrogen preparations and how they are available? First, they are started as low dose, started as low as possible. Okay, then gradually increased. Okay, so doses gradually increase. So there are three types: ultra low dose, then low dose, and then standard dose. In low dose, the estrogen preparation is very less. Okay, so which type of preparation? See, three types of preparation. First, see, in the first is conjugated equine estrogen. This pen is not working. Let me see. Conjugated equine estrogen, then micronized estradiol, and then transdermal preparation. So in ultra low dose it is 0.3 milligram per day. Okay, in ultra low dose conjugated equine estrogen it is given in 0.3 milligram per day, and 0.25 microgram per day, 0.23 milligram per day it is given. Okay, and in transdermal preparation it is very less, 0.014 milligram per day, and in low dose it is 0.45, in standard dose it is 0.625 milligram per day. Okay, and in the micronized estradiol it is in low dose it is 0.5 milligram per day, and it is 0.75 or 1 milligram per day, and in transdermal preparation low dose it is given as 0.025 milligram per day, and here it is 0.05 milligram per day. So these all you need to remember. And what are the progesterone? Similarly, what are the progesterone formulations? Progesterone it is mostly given orally or vaginally. Okay, progesterone preparation it is given most commonly orally or vaginally. It is given in combination with estrogen. Preparation. Okay, and the preparations are, what are the preparations? Micronized progesterone first, micronized progesterone, synthetic progestins, LNG IOD, that is levonorgestrel intrauterine device, and then medroxy progesterone acetate, medroxyprogesterone acetate, and norethindrone or norethindrone. Okay, so these are the progesterone formulations. Also, testosterone therapy can be given. So, what are the indications for testosterone therapy? The testosterone is added in case of, it is added along with HRT, okay, in females with sexual interest and arousal disorders. In postmenopausal women with sexual interest and arousal disorders, we can also add testosterone. Okay, but here previously HRT conventional HRT must have been given. Okay, so what is the route? Route is in transdermal testosterone, it is 300 microgram per day, and testosterone even gel also can be given, gel or cream, we can, that is applied in upper thighs and lower abdomen. Okay, upper thighs or lower abdomen, and after using or massaging it, immediately we must wash the hands. Okay, and here the preparation is 5 milligram. Okay, SCOG recommends that we must do a baseline testosterone level. Okay, so before giving the testosterone preparations to the postmenopausal women, okay, with sexual interest and arousal disorders, we must do the baseline testosterone and then repeat in 3 months and 6 months. What should be the baseline testosterone? It must be within normal limits. Okay, what is the normal limit? Normal limit means it should not be higher than normal for the premenopausal woman. Okay, in premenopausal women, the amount that should be present, okay, that is the upper limit of the baseline testosterone level before giving the HRT. And what are the non-hormonal methods that can be used, okay, to prevent the postmenopausal symptoms? We can give SSRIs and SNRIs as well as the gabapentin and clonidine, and the lifestyle measures like can do exercise, regular exercise, weight control, and will avoid coffee or caffeine related substances to decrease the vasodilatation and decrease the flushes or vasomotor symptoms, and good sleep and hygiene, that matters the most. Okay, so thank you, keep learning.